Welcome to Health Tech Talk. This is where business, healthcare, and technology collide. Our host, Ben Chodor, interviews healthcare innovators and industry titans who are striving to make the world healthier with bleeding-edge human ingenuity. You'll hear it all on Health Tech Talk. Now, here's your host, Ben Chodor.
Good morning, good afternoon, good evening, wherever you are. I am Ben Chodor, and you're listening to Health Tech Talk, broadcasting live from 640 WGST in the iHeartRadio studios and streaming worldwide on the iHeartRadio network. In our first segment, we have a great guest, one of my favorite guests, Jack Barrette. He is the CEO and co-founder of WEGO Health. WEGO Health is a social network that empowers hundreds of thousands of patients and influencers to help others drive health innovation. Jack's previous jobs is he's been part of Yahoo Health. He is an amazing, amazing guest. He's an amazing man. I like to call Jack a friend, but most importantly, he is doing amazing things. So, Jack, welcome to the show, and good afternoon. How are you?
I'm great, Ben. Thanks a lot for having me.
No, thank you for taking time out of your day. All right, first, let our audience know. All right, so we have this incredible audience listening today, and I love to start our first segment with something that really touches them. So people driving around in their cars, people listening on the iHeartRadio network are patients, and they are consumers, and they are corporate executives, and they are pharmaceutical executives, and you're listening to Health Tech Talk, so you're interested in this space. How would you describe WEGO Health? And you started it how long ago?
WEGO Health started about exactly 8 years ago. It'll be 8 years in February.
Happy anniversary.
Thank you. Thank you. And we're most proud of. We are fundamentally a network of, as you said, patient influencers. We've focused exclusively on that literally 4% of health consumers who create 80% of online health content. We did it since our founding in 2007. We've been looking at who's influential, who reaches a lot of people, but who's passionate and connects with other people in online health communities. Now we've just surpassed an exciting milestone for us. We have over 100,000 patient influencers as active opted-in members of WEGO Health. So hold on, let me interrupt you for a second.
So 100,000 patient influencers reaching an audience of potentially millions. What makes someone a patient influencer? Like, how would I become a patient influencer, or how do you choose what a patient influencer is?
Well, we've actually spent a lot of that 8 years and millions of dollars of other people's money, thank God, on building proprietary technology that starts with social monitoring and looks at, who's got a lot of people listening to them talk about health. But because we're a membership network, we can also ask people to register and sign up and participate in WEGO Health membership programs. So they tell us a lot of things like, yes, I actually am interested in breast cancer. It's not just something I tweet about occasionally. I am genuinely excited and passionate about that. And then we can also watch what they do as they interact with those programs. So we are constantly and dynamically kind of vetting who is truly influential and relevant in the health space. If you ask Clout who's relevant in diabetes, they tell you it's Oprah because she tweeted twice about diabetes in 1999. But the reality is that the real influencers are harder to find, and we spend a lot of time finding the bloggers, tweeters, pinners, Facebookers, empowered patients that really are driving the conversation online every day.
So in some ways, you basically empower these influencers to reach a targeted audience, or the audience that they want, but also the people who want information about it to find the appropriate influencers. And then if you can answer that, and then also at the end of that, let me know, is everything all virtual? So is it all through blogging and tweeting and tech, or is there any physical? Is there any meetups?
Well, first of all, we absolutely, the benefits we provide to our influencer members, they're already influential when we find them, or they're becoming influential, right? On average, they actually reach about 15,000 members each per month. So that's a lot of followers times 100,000. Obviously, there's lots of duplication in that world, but the reality is that we find them as influencers, but then we connect them to each other. We connect them to even broader audiences. We teach them, should you bother with Google Plus or not? How do you handle death in your community? So we attack issues and as an association would for a physician, but these are patient leaders, patients who are getting better at their practice of leading online communities. That's our value to them, and that's how we grow them as leaders. You asked if it's all online. It is very much online, but yeah, we absolutely do meetups. We send people to conferences to cover those, and some of those powerful experiences we've had are people coming from Atlanta to Boston to our headquarters to meet us to come to a meetup because that's how connected they want to be to the other people in this community, and how important and passionate they feel this connection to each other really is.
Jack, it's not limited to any disease states, right? So you're open to how many different disease states, how many different topics do your influencers speak on?
Well, on the WEGO Health website, WEGOHealthSolutions.com, we actually have something called an influencer tracker because so many people have asked us that question. We actively track about 140 different conditions, if you will.
Wow.
And you can anytime you want, you can go and look up how many member influencers we have in each one of those conditions at any given time. But the reality is this is social media content, right? So we have the content of all of our influencers stored and archived, and we can query that. So if someone wants to dive deep into a subset of those 140 conditions, or even go to something at the horizontal like access to care issues, for example, we can find people who are influencers actively discussing that topic and bring together a cohort of people around virtually any health topic. As you imagine, we have billions of conversations that are archived and searchable, and we're always able to find who's having those conversations because we know them and they know us and they've opted in for us to contact them.
And so those of you listening to Health Tech Talk, if you want to check out the website, it's www.wegohealth.com. So check it out. There's a lot of great information there. There's great reading, great videos. There's so much there. You can spend a lot of time on there. Jack, what was the first disease state you started with when you started the company?
Well, it's interesting. We actually picked 3 to look at different types of relationships: diabetes, intensive daily chronic disease. We looked at migraine, which intensely acute, episodic, but also life-changing. And then we looked at diet and nutrition for more of a lifestyle management. And from that beginning, grew we found lots of people who really not by design had all 3 conditions, not very surprisingly to us, but then we grew into lots of those other different disease areas. So we learned a lot and about how different patient communities really are. I mean, if you talk about the diabetes advocate community, which is incredibly evolved as versus a niche cancer community, the way they operate, the way that the members act toward each other is very, very different and very interesting.
So Jack, 8 years later, what is the 3 biggest areas that we have the most influencers in right now?
The 3 biggest are definitely, probably not surprisingly, cancer and oncology is an incredibly patient-involved space, and I think perhaps to the surprise of the medical community, they really care about the chemo drugs they're on. They care about the side effects and living with or through treatment in many cases, and they care about helping each other, even with terminal cancer. So oncology, big area for us. Autoimmune disease is a very important, and that relates very much to women's health. And so they're not always the same thing, but there is a strong connection between the two, and 80% of our patient influencers are women, which again, not something that was by design, but that's what we've found in finding people who are most active online in the health space. 80% are women. So,
and not surprising.
Women's, yeah. So I would put in beyond that, we've got chronic disease in general. If what are we, probably better to look at where we not have a sizable community. Seasonal allergy, not a big area for us. Episodic, minimal pain relief, like over-the-counter drug medication, that kind of like Advil. Those aren't our sweet spots. Lots of great over-the-counter products that we work with, but tend to be on more chronic issues.
So Jack, when we come back from my commercial break, I want to get much deeper into the company and where you're going with and how you work with corporations. But I need to cut to commercial break. But before this, I'd like to say a special thanks to 1-800 Public Relations for all their PR and media support, and to Stream VPG for all their production support on this, and also to everyone at WGST for all their help in putting together the program. And again, we are talking to Jack Barrette. He is the co-founder and CEO of WEGO Health, and it's an amazing organization. You're going to learn more about it when we come back from this break in a few seconds. So we'll be back in a second. Thank you very much.
Okay, our daily deal is the free teeth whitening kit again. If you want your teeth professionally whitened but haven't had the money, listen up. National Dental Supply is giving a free whitening kit to the first 50 listeners who call 800-913-7041. It's the same strength sold by dentists. Get a white smile to look young and healthy. Call right now before the 50 free kits reserved for our listeners are gone. Call 800-913-7041. 800-913-7041. 800-913-7041. 7041.
What are you doing?
I'm turning this hedge into a dolphin-shaped topiary.
But this house isn't yours. In fact, I just showed it to you.
Oh, I'm gonna buy it.
Softly confident.
Well, I am an excellent candidate for a home loan. I pulled an 809 FICO score at Experian.com, so getting a mortgage is merely a formality. What do you think I should do with this other hedge? A giraffe?
Get your credit swagger on. Become a member of Experian Credit Tracker and find out your FICO score powered by Experian. FICO scores are used in 90% of credit decisions.
Buying a car can be the worst. Scotty from the Power Morning Show. Unless you're using TrueCar.com, they're helping you save time and money. Two things we all wish we had more of. Helping you to never overpay. Users see an average savings of over $3,200 off MSRP. It's a pretty simple three-step process. First, you go to TrueCar.com and find out what others paid for the same car you're looking for. Second, register at TrueCar.com to see your upfront pricing information and lock in your savings certificate. And third, it's simple. Just print out your certificate and take it to the TrueCar certified dealer for a better, hassle-free car buying experience. Don't buy a car without using TrueCar.com.
Hello, everybody. Alan Thicke here. You know, our nation's tax laws change every year. The one constant is you have to pay them. Now, if you're one of those millions of Americans who owes back taxes, you know that the IRS is cracking down. They can garnish your paycheck, levy your bank accounts, even your home or business could be up for grabs. But here's the good news. They're offering a new way out. It's called the Fresh Start Initiative, a government program for tax debt forgiveness. You could qualify for a settlement that's substantially less than before these changes. And nobody knows this program better than the experts at Optima Tax Relief. Their attorneys and enrolled agents will work to get you the best deal possible. Optima Tax Relief is accredited by the Better Business Bureau. Call them now for a free consultation.
Call 800-798-2477. 800-798-2477. 800-798-2477. Some restrictions apply. For complete details, please visit OptimaTaxRelief.com.
Okay, our daily deal is the free teeth whitening kit again. If you want your teeth professionally whitened but haven't had the money, listen up. National Dental Supply is giving a free whitening kit to the first 50 listeners who call 800-913-7041. It's the same strength sold by dentists. Get a white smile to look young and healthy. Call right now before the 50 free kits reserved for our listeners are gone. Call 800-913-7041. 800-913-7041. 800-913-7041.
Unite to fight congenital heart disease at the Greater Atlanta Congenital Heart Walk, Saturday, April 25th at the North Georgia State Fairgrounds in Marietta. The Adult Congenital Heart Association and the Children's Heart Foundation honor and remember those impacted by congenital heart disease, the #1 birth defect in the U.S. So unite to fight, Saturday, April 25th at the North Georgia Fairgrounds in Marietta at the Greater Atlanta Congenital Heart Walk. Find out more and register at congenitalheartwalk.org or call 1-855-CHD-WALK.
The Dave Ramsey Show, Monday at 2:06 on Talk Radio 640 WGST.
Welcome back, and if you're just tuning in, you're listening to Health Tech Talk, broadcasting from iHeart Studios in Atlanta, 640 WGST, and broadcasting around the world on the iHeart Radio network. And with me is Jack Barrette. He is the CEO and co-founder of WEGO Health. WEGO Health is an organization that specializes in patient influencers. Jack, this is an amazing first segment we had, and now as we go into the second segment, I got to ask a couple questions. First one is, how do you find your influencers? And two, if I'm an influencer out there, or if I'm someone listening to the show and I have a following and I want to stand up and start talking about something, how do I get in touch with you guys?
Mm-hmm. Well, we find our influencers usually by their identifiable online conversation, and very often it's behind usernames and that kind of thing, but we build this proprietary technology that helps us to find those folks who are having those frequent well-followed and respected conversations, and we reach out to them. We reach out through Twitter, through Facebook, through email, whatever we can do to find those folks who are most connected to us. And we're lucky now, having 100,000 members in the WEGO Health patient influencer community. They refer each other to us now. We've become, we hope, the
So, Jack, in a way, you have agents out there, or people part of WEGO Health that are out there looking for the greatest influencers.
Yes, we do. We have both technology agents, but much more importantly now, our members are each one of them, hopefully, advocates for us and finding other folks and saying, yeah, you got to join WEGO Health. They will help you with your leadership as a patient influencer. So
it's not closed, right? So there's still room, if I'm an influencer in diabetes or oncology or migraines, there's room for me, or colitis or Crohn's, there's room for me.
Absolutely. At WeGoHealth.com, you can sign up for any one of our programs. The reality is that if you're not an influencer by our standards, you won't get as many opportunities to do things as those who are more highly influential, but that's something that will help you to grow and we'll learn about you as we go along and get to know you better.
All right, so I'm going to ask you the natural question again, because everyone's listening to Health Tech Talk. So our audience is made up of consumers and patients, but this is a big investor community and it's a business show. How do corporations get involved with you? And I got to guess, pharmaceutical companies and digital health companies want to engage with an organization like WEGO Health. Or if I was doing a company, a startup, and I just raised several $1 million in a disease state, my God, I would want to get these influencers involved to know about my product. Do you work that way as well, or is it just about getting information out there?
No, you'd be right to want to get us involved, absolutely. WEGO Health is working with companies of all sizes in a couple of different ways to activate. And what we do at the highest level is connect companies to millions of hyper-engaged health consumers through our network of patient influencers, right? So what we do is about half insight work, so qualitative, I would call it advisory board level consultation from our influencers. We've found we've created very low-friction tools like our smartphone-based Truvio platform that lets people connect with influencers to get great voice commentary about everything from ad campaigns to the design of a clinical trial. And that's really made it, very easy for people to really consult patient leaders as they build virtually any part of their strategy or product set. That's fun for startups who are, trying to figure out how can I possibly talk to patients as often as I want to. We make it easy and quick, and I love working with those companies.
So can I ask you a question? Because I'm sorry for interrupting,
Sure.
but I'm familiar with your Truvio product. I know Fabio pretty well, some of them you work with, and you guys built something pretty amazing. But this is sort of a survey tool for an audience. So if I'm a pharmaceutical company and I want to engage with you to reach a certain amount of influencers and ask them a series of questions, and it's all done from my smartphone, can you just describe it a little bit more?
Sure. Well, because we have a membership relationship at WEGO Health with our patient influencers, they've given us opt-in permission to text message them and send them through their smartphone stimuli. So view a website we're thinking of building for this brand. Tell us what you would improve here. Tell us if you would share this with your community as an influencer. And these influencers can contribute voice comments. So you hear 1 or 2 minutes of someone who leads 15,000 people every month saying, look, I know you're trying to do a symptom checker, but the fact is the nonprofit can actually mention the brands by name, which you can't do because you're Pfizer or you're Novartis or you're Amgen. And so I think you should skip the symptom checker. Save yourself $500,000. Excuse me. And so there's a tremendous wealth of knowledge and experience in these guys that act like a patient advisory board because they have that. They can speak on behalf of their community. And the Truvio tool makes it 72 hours later, you can be hearing 20 audio clips of some of the top leaders in the field, in the patient field, that talk about whatever it is you need to put in front of them.
So you're also a technology company. You're building products to better serve your community.
Yeah, we really are a powered by model now. Now that we have this 100,000 patient influencers at WEGO Health, we like to believe we're the chip that plugs in and makes things run. We're the intel inside Truvio, right? Truvio works because it has access to our patient influencer network. It's a great technology, but it's the brilliance of our audience, of our members, that makes it really run. We're also powering a program called CureClick that's a patient-powered clinical trial recruitment service where we've literally created overnight 100,000 CROs by asking our members to go find trial participants in their audiences.
And that's the number one fan in the background, your dog.
There you go. There you go. That's the pet version of WEGO Health is coming next.
That's right. We're gonna be tracking your pets. So also, you're becoming a data company. You are a blind data company. The information you have from your influencers and the patient community could be used to help change healthcare.
Absolutely. There's no question that we know and we believe that the power of 100,000 influencers, each reaching 15,000 people a month, is the greatest force for change in healthcare that one can imagine. So, both at the qualitative level, as we described for Truvio, but then also quantitatively to say, what are the influencers talking about? What are their methodologies for behavior change? When does their community actually change its behavior? Well, and what messages are resonating with them? There's a wealth of data in not just what's being said, but what's working, what's actually happening within their communities.
Wow, that's great. And so how does your organization make money?
Well, 2 ways. Half of it is insights work that I just described through Truvio. We also do online focus groups and lots of and advisory panels. As you imagine, people want to plug into that, to our network for insight. The other half is activating the communities of our leaders. So we create content marketing programs, which effectively ask our members to share content from a sponsor to their audiences in order to activate the social sphere on their behalf. So typically we'll feature content that we've vetted already with our members, and like what of the sponsor's existing content or what new content should we build? What will you actually share in your community if we put it in front of you? And when we take the time to do that, when we have a relationship that we do with patient influencer members, they'll tell us, look, I'll share this because WEGO Health asked me to? No, because education is important for my community. They want to know about specific brands. Like we have a great program running for Xeljanz and Pfizer right now, where there's content on that's on their website, but it's not being found. But our influencers said, my community needs that. I want to share it. And so we make it possible for them to share that and activate millions and millions of social conversation as a result.
I think that's amazing. It's amazing what you're doing, and I think you're silly if you're a pharmaceutical company or a biotech company and you're going into the space without tapping into the community that will not only be using your product, but before anyone uses the product, they're going to go online and they're going to communicate amongst themselves and say, has anyone used this? What do you know about this? Because we're in a world where we don't so much trust what corporate America says, but we trust the influencers that we follow. And
that's exactly right.
In a lot of ways, that's what WEGO's all about. And I only have a few more minutes with you, so there's a bunch of questions I want to get to. But one of the things I want to get to is your activist awards, which sort of ties into this. So I was a judge a couple of years ago. It was a great honor. And this year, it seems like from 3 years ago to now, it's night and day. It is so huge. Let my audience know what it is, how they can check it out, and how they can get involved or nominate someone for future.
Well, thanks for that. We love the WEGO Health Activist Awards program. We've been doing it for 4 years now. We didn't start it from day one because we wanted to be real, but now we have thousands of nominations of individuals and patients nominating the leaders they feel are most inspirational in 14 different categories, from your Best in Show Facebook to Best Blogger and everything in between. If you go to WEGOHealth.com, you'll see right in the top nav there's an awards section. You can see the nominations are closed. We have thousands of nominations. You can see all of them. You can see them describe themselves. It's a cool way to meet thousands of our members and kind of understand the variation and all the different shapes and sizes of those folks. It's really inspiring. But you can still endorse them. You can still say, like, if you see someone you know, if you see someone whose story inspires you, can endorse them by just hitting a couple of links and show them that you're part of the community that's behind them. So WEGO Health Activist Awards, WEGOHealth.com is a great place to check out. Again, a really good peek into our community in a really exciting way.
So give me an example. Like, who won last year, like, Best in Show? What was and what was the criteria of picking that person or that organization?
Well, the fun part of the awards is that you can, Inkwell Creative won Best in Show Community or Forum. It's actually a British site that had done some really exciting mental health. But what they did is created a different way of communicating people with art and with photographs and visuals that really resonated with the community, and it stood out as something that was, look, I'm not just going to do another place where you're trying to figure out why is it different, but they found a way to kind of up the game, not technologically, not with a lot of money, but because they were, they're called Inkwell Creative Minds. They thought of a way to kind of bring to life this, kind of sometimes immutable issue of mental health and get people engaged in a way that started a whole new type of conversation. So that's the kind of...
That's awesome, Jack.
Not a lot of people knew about it in the U.S. Now they've kind of blown up as a result of getting that recognition last year. So we're really proud of that kind of...
When will this year's award or last year's award winners be announced? We're in award season. Oscars are a couple weeks away. When are the activist awards? When are we going to know who the winners are?
Well, you have to go to WEGOHealth.com to the award section to get specifics, but we'll announce the winners in March of 2015. So there's a massive amount of judging to do, and really, as you remember, Ben, take our time going through. We have a panel of both health activists as well as industry leaders kind of going through and culling through the thousands of nominees we've got. So it takes us a few months, but we'll be doing that in March.
You got to eventually do this as a physical event. This is an award show I want to watch on the web, on YouTube, or on your site. And Jack, I am running out of time. I just got one question for you before we get out of this segment. Where are you going to be in 5 years from now? You got 10 seconds to answer. Where do you expect to be?
Well, I expect that we'll be on the cover of Time magazine as the engine of change in healthcare, that patients have become the center of how healthcare change has taken place in a massive way, from clinical trials to new treatments that have been discovered, that that we're seen as the engine that made that happen, and we'll be proud of it.
Thank you very much, Jack. And check out WEGO Health at WEGOHealth.com. An amazing organization and an amazing CEO. I need to cut to a commercial break, and I want to give a special thanks to 1-800-Public Relations for all their PR and media support, and to Stream VPG for all their production that they've added. And we'll be back after these words from our sponsors.
Atlanta.